when the patient's symptoms is very bad, but the nerve compression on MRI scan is not too bad, or when the leg symptoms is on the left side, but the compression is worse on the right side. The symptoms and the MRI scan are not matching. I personally like to do diagnostic spinal injection first before jumping into surgery. This is to confirm if the symptoms is really caused by the nerve compression in the spine. Hi everyone, welcome to my channel. My name is Dr. Tony Setiobudi. I'm an orthopedic and a spine surgeon at Mount Elizabeth Hospital, Singapore. If you are new here, please help me to subscribe to my channel. I will continue to share accurate, up-to-date and trustworthy medical information in the language that you all can understand. If there is any medical conditions, especially regarding bone, joint and spine, you want to know about, please write it down in the comment section below. I will try my best to answer your questions. Spinal injection can be done in the back or in the neck. It is not an ordinary injection that can be done in clinic setting. An X-ray is required to guide the needle placement. It must be specific. Therefore, although it is not a surgery, it must be done in places like operating theater or an interventional radiology suite. Spinal injection is performed for diagnostic and therapeutic purposes. For example, when the patient's symptoms is very bad, but the nerve compression on MRI scan is not too bad, or when the leg symptoms is on the left side, but the compression is worse on the right side than the left side. The symptoms and the MRI scan are not matching. I personally like to do diagnostic spinal injection first before jumping into surgery. This is to confirm if the symptoms is really caused by the nerve compression in the spine. At the same time, steroid can be injected to the proximity of the nerve compression. Steroid has anti-inflammatory property that suppress pain signals from inflamed spinal nerve and improve the function of the lower back and the legs. I typically advise for spinal injection for cases where the nerve compression is not severe on MRI scan, and if after initial non-surgical treatments such as with medication and physical therapy have been tried without sufficient pain relief, or if the patient is in too much pain to progress with physical therapy, I may consider spinal injection. The pain relief from these injections may help to limit or eliminate the need of oral medications. In some cases, the need of surgery may also be potentially eliminated. The nerve compression can occur from a slip disc or a spinal stenosis. If you want to know more about slip disc and spinal stenosis, you can watch my other video. Sometimes I also do spinal injection for back pain from a tear in the disc or annular tear that does not cause nerve compression. But I rarely do it for this condition because most of the time the pain becomes better on its own. Only when the pain persists for prolonged period of time, then spinal injection may be considered. Epidural steroid must not be given when there is infection in any part of the body, including the site of injection, or if there is any bleeding disorder or tumor in the spine. Additionally, the injection must not be used if there is a known allergy to the steroid medication, local anesthetic, or the dye, the contrast dye used for X-ray. In some conditions, such as uncontrolled diabetes, heart problems such as congestive heart failure, pregnancy, especially if an X-ray is used, or osteoporosis, I will hesitate to perform spinal injection. While spinal injection is very effective in relieving the back and the leg pain from nerve compression, the effects are usually temporary. The recurrence of pain is not predictable. The pain may come back and the duration of pain relief is variable. It can last more than 6 months or it can be as short as a few days. When the pain is better after spinal injection, the patients can progress in physical therapy or rehabilitation. Further, spinal injection may be recommended if the duration of pain relief is more than 6 months. Pain relief more than 6 months is considered a good result after spinal injection. In the next video, I will share about surgery for spinal stenosis. If you have any questions about spinal stenosis and the treatment, please write some comments in the section below. If you have any experience with spinal injection or any other treatment for spinal stenosis, please share it here as well. It may help other people with similar condition. Thank you so much for watching, and I hope this information is useful for you. If it does, please give me a thumbs up and don't forget to subscribe and share this video, and I hope to see you again in my next video. Bye bye.